Hello team, welcome to our SCI educational series number 8 on enhancing patient safety. Today's topic is hand hygiene as a frontline defense in SCI Care. Hand hygiene remains the cornerstone of infection control. For individuals with spinal cord injury or SCI, this practice becomes even more critical. Due to immobility, bladder dysfunction, and increased risk for pressure injuries, SCI patients are particularly vulnerable to infection. My name is Michael J. Orellano, your SCI nurse educator. This session is designed to reinforce your critical role in promoting a safe clinical environment. We will discuss how consistent hand hygiene, effective documentation, and prompt escalation can significantly reduce infection risks. Our collective efforts not only protect patients but also strengthen staff trust, compliance, and care quality. By the end of this presentation, learners will be able to achieve 3 essential objectives that directly impact patient safety in the SCI setting. First, learners will recognize infection risks specific to SCI patients, such as those related to catheter use, immobility, and pressure injuries. This knowledge supports proactive clinical assessments. Second, staff will be equipped to apply the World Health Organization or WHO's 5 moments for hand hygiene and use appropriate techniques, such as alcohol-based rubs or soap and water, depending on clinical context. This reinforces standardized, evidence-based practices that prevent hospital-acquired infections. Lastly, learners will gain confidence in documenting infection indicators accurately and escalating concerns such as drainage, fever, or wound changes to the appropriate provider or wound care nurse. These actions ensure prompt intervention and protect against adverse outcomes. These objectives are foundational to enhancing safety and quality of care in every SCI patient interaction. Recognizing hidden infections in SCI patients with proactive care. SCI patients often utilize devices such as catheters and ventilators that compromise their immunity. Coupled with limited sensation, these individuals may not show traditional signs of infection like fever or pain. Therefore, frontline staff must rely on subtle indicators, changes in behavior, wound characteristics, or new drainage. Infections in SCI populations are linked to delayed wound healing, sepsis, or readmissions, underlining the need for proactive prevention through meticulous hygiene and observation. The World Health Organization, or WHO, identifies 5 critical moments for performing hand hygiene, each aligned with a specific point in patient care to interrupt the transmission of pathogens. First, before touching a patient, whether for repositioning or checking vitals, hand hygiene is essential to avoid introducing microbes. Second, before performing an aseptic task, such as wound dressing or catheter insertion, clean hands protect vulnerable body sites. Third, after exposure to bodily fluids, even when gloves are used, hand hygiene prevents the transfer of blood-borne or exudate-related pathogens. Fourth, after touching a patient, hand hygiene protects other patients and surfaces from possible contamination. Finally, after touching patient surroundings like bed rails or call buttons, which may harbor germs even without direct contact. These moments are especially critical in SCI units where patients are at high risk for infections due to frequent interventions. Hand washing is more than just a task. It is a clinical imperative. In SCI populations, studies reveal increased colonization with multidrug-resistant organisms MDROs, including MRSA and VRE. These risks heighten during hospitalizations or when invasive devices are used. Pathogens can survive on hands for minutes, making hand hygiene the most effective intervention. Regular hand washing interrupts these pathways, especially before aseptic care or when switching tasks between patients. Reinforced hand hygiene compliance has been directly linked to lower rates of hospital-acquired infections, or HAI, reduced mortality, and shorter hospital stays. Proper technique is non-negotiable. Use alcohol-based hand rubs for most clinical interactions. They're quick and effective. However, if hands are visibly dirty or exposed to organic material, soap and water are required. Lather for at least 20 seconds, scrubbing all surfaces including between fingers and under nails. In SCI units, hygiene opportunities arise during repositioning, transferring, or assisting with toileting. Embed hand hygiene into each of these actions to reinforce safety culture. Making it routine ensures compliance and reduces cross-contamination. Hand hygiene must be paired with accurate documentation. In CPRS, record objective findings: redness, swelling, discharge, or foul odor, promptly and clearly. These notations aid in clinical decision-making and validate timely referrals to wound care nurses or providers. Failure to escalate concerns such as abnormal drainage or new wounds can lead to sepsis or preventable hospitalization. SCI patients rely on proactive staff interventions, making your assessment, documentation, and advocacy critical to outcomes. In SCI Care, hand hygiene is not a routine formality, it is an emergency-level intervention. Preventable infections can rapidly progress to septic shock, especially in patients with suppressed immune responses. Hospital readmissions due to infections result in prolonged care plans, increased costs, and emotional distress. Moreover, recurring hospital-acquired infections, or HAI, damage the public's trust in healthcare settings. When staff fail to comply, it undermines clinical safety and accountability. Practicing thorough hand hygiene demonstrates professionalism and safeguards lives. Misconceptions often interfere with proper hygiene. Gloves are not a substitute. They should always be accompanied by hand hygiene before and after use. Concerns like dry skin can be addressed using hospital-approved moisturizing lotions. Strategic workflow redesigns such as placing dispensers near patient beds or charting stations also improve compliance. These solutions make hand hygiene more feasible and reduce missed opportunities. Addressing barriers is not just about convenience, it's about reinforcing a non-negotiable safety standard. So, what's our takeaways? Hand hygiene is the first and often most powerful step in preventing infection in SCI patients. Its effectiveness multiplies when paired with timely assessments, thorough documentation, and immediate escalation. Every interaction, every patient touchpoint is an opportunity to reinforce safety. Sustaining compliance requires mutual support, accountability, and leadership. Together, SCI staff can set a gold standard of care that others model. Infection control is not one person's responsibility, it is a culture of shared vigilance and professional pride. The references used throughout this presentation reflect the most current and authoritative literature available on hand hygiene, SCI-related infection control, and clinical safety strategies. These sources include guidance from the CDC and WHO, which are foundational in shaping hand hygiene policies across healthcare settings. These resources were selected not only for their relevance but also to support best practices that directly impact SCI patient care. Adherence to their recommendations can enhance our infection prevention efforts and reinforce a culture of safety within our unit. Thank you for your dedication to SCI patient safety and for engaging in this important conversation. Each hand hygiene moment you practice is a safeguard against infection and a step toward better outcomes. Our patients trust us not just with their care but with their lives, and that begins with clean hands. Let us carry this knowledge forward and support one another in translating it into daily routines. Together, we can elevate infection control practices and lead the way in SCI safety. Let's move from education to implementation and set the highest standards of care in everything we do. Again, thank you very much.